Everyone, my name is Kento Kisai, Translation Research Center for Medical Innovation, TRI Center, Japan. So today, we are honored to present under the title, a detection method for aberrant signaling pathways based on a mathematical model using gene expression levels and pathway maps. So first, let us explain the pathway maps. These maps are composed of the elucid signaling pathways. The squares represent proteins, while the rows and T-shaped lines indicate protein-protein interactions, PPIs. These protein-protein interactions mean the association and dissociation between successive proteins. Chain of them leads to the expression of cellular functions at the downstream end of the pathway. Next, let us explain the gene expression levels, GELs. The key to the expression of cellular functions lies in proteins. At the surrogate of protein levels, RNA molecules, that is, gene expression levels, are quantified. These can be used as open data from cross-sectional studies where the disease tissue group is referred to as a case and the healthy tissue group as the control. Here is an example of the gene expression dataset. From the left, we have the ID representing the patients, the group indicating the case or control, and A1, A2, and A3, each representing the expression levels of different proteins. It is widely believed that the cause of many diseases lies in aberrant signaling pathways, ASPs. It is thought that the aberration in the chain of protein-protein interactions leads to cellular dysfunctions, resulting in disease onset. Therefore, if we can detect disease-specific aberrant signaling pathways using these pathway maps and gene expression levels, we may be able to contribute to both a deeper understanding of disease-specific mechanisms and development of new therapeutic drugs. Objective. In this study, we propose a method to detect aberrant signaling pathways by developing a mathematical model and detection measure for each protein-protein interaction based on pathway maps and gene expression levels. We evaluated the detectability of the proposed method by applying it to open data. So the development and evaluation of the proposed method were carried out in the order stated in the objective. First, development of a mathematical model for each protein-protein interaction. We focus on any interaction, protein 1 and 2, within the pathway map. Here we assume that the expression level of protein 1 represented by PJ1 times XIJ1, and the expression level of protein 2 represented by XIJ2 can be involved in the interaction. Note that XIJ1 and XIJ2 represent the protein expression levels of individual I in group J, and PJ1 represents the association proportion of group J. The interaction is characterized by the free forms and the associated product, and they repeatedly undergoing association and dissociation. We also assume that the product levels can be explained by the expression level of PJ2 times XIJ2, and the free forms of protein 1 and 2 can be explained by the involved expression level minus PJ2 times XIJ2, respectively. Moreover, we assume an equilibrium state where the rates of association and dissociation are balanced. Under these assumptions, we introduce an association constant K2. This parameter represents the affinity between protein 1 and 2, and K2 is defined as this equation. Based on this equation, we propose a mathematical model derived as a nonlinear regression model. A detailed explanation of the mathematical model is provided in the poster presentation. Next, using the parameters of this mathematical model, we developed a measure to detect aberration in each protein-protein interaction. Here is an overview of the measure. For each protein-protein interaction, with the model parameters of the P12 and P02, the numerator represents the difference in the magnitude of signal transduction between the case and control, while the denominator represents the standard error, SE, of the difference. This measure is the difference considering statistical precision, and the larger the absolute value, the more likely it is that aberration lies in the interaction. A detailed explanation of the detection measure is provided in the poster presentation. To evaluate the detectability of the proposed method, we applied it to open data consisting of the mTOR signaling pathway map and gene expression levels from the lung squamous cell carcinoma and clear cell renal cell carcinoma. The results and discussion are reported on the day of the poster presentation. This research was supported by the Japan Agency for Medical Research and Development, AMED. There are no conflicts of interest to disclose. Here's a list of the references. So we would be grateful for the opportunity to discuss our method with all of you on the day of the poster presentation. So please do visit poster 24107. Thank you.